Gentleman from California.
Thank you, Mr. Speaker. I yield myself 2 minutes.
Gentleman is recognized for 2 minutes.
It's an important day, and we've been working to achieve mental health parity for decades. We finally have a bill for us to achieve that goal for more than 160 million Americans, and as my colleagues know, this bill is named for one of its chief proponents, the late Senator Paul Wellstone of Minnesota, a true champion for all people, and especially those suffering from mental illness and addiction disorders. I would like to recognize the efforts of Paul's son, David Wellstone, who's been commuting from California to lobby members of Congress to help get this bill enacted. His dad would be proud, and Wellstone Action is one of the hundreds of groups supporting this legislation. Here in the House, our colleague from Minnesota, Jim Ramstad, and our colleague from Rhode Island, Patrick Kennedy, been lead advocates. They've done a stunning job getting 273 co-sponsors, including 41 Republicans, a real bipartisan feat in this day and age. Enough of the accolades. The real reason we're bringing forth this bill is to end discrimination in health insurance for people with mental illnesses and addiction disorders. It's not a new concept. We took a baby step back in '96, but it wasn't enough. This bill does for our constituents what we already received through the Federal Employees Health Benefit Plan. We also passed the Children's Health and Medicare Protection Act last summer, which would extend mental health parity to Medicare beneficiaries. That bill is still pending in the Senate. Last year, this legislation went through multiple hearings, 5 markups in 3 major committees, and the issues are straightforward. Those who oppose true parity may engage in scare tactics or offer red herrings to distract from the underlying issues, but one thing is clear. The bill is better for patients than the Senate bill, yet the cost is almost exactly the same. The passage of the Paul Wellstone Mental Health, I yield myself 10 additional seconds.
That's right.
Passage of the Paul Wellstone Mental Health and Addiction Equity Act simply finishes the work we've begun, and I look forward to negotiating with the Senate so we can get a bill to the President's desk soon. Tens of millions of Americans are counting on us, and I urge support for this overdue legislation.